Now, let's take a deeper dive into ADHD with our panel of experts. Joining us are Dr. Arthur Bregman, Dr. Gilbert E. Franco, and nurse practitioner Rashonda R. Musauer. Arthur Bregman, MD, is a Miami psychiatrist who has been in practice for years. Today, he and his practice of psychiatrists and therapists see patients of all ages who need mental health support. His specialty is in ADHD, both for adolescents and adults. As an early adopter of telemedicine, Bregman currently sees patients from Florida and across the country. His expertise in child and adolescent psychiatry was instrumental when he served for more than a decade as chief of psychiatry for Nicholas Children's Hospital in Miami. Gilbert E. Franco, PhD, is a licensed marriage and family therapist and an assistant professor of psychology at Beacon College. Before coming to Beacon, Franco served as clinical director for the McAllister Institute in El Cajon, where he supervised interns studying marriage and family therapy and clinical social work. He earned his bachelor's degree in psychology from the University of California, San Diego, a master's in marriage and family therapy from Alliant International University in San Diego, and a master's in organizational psychology from Walden University in Minneapolis, where he also earned his PhD in IO psychology. Rashonda R. Musauer is a pediatric nurse practitioner with the Orlando Health Arnold Palmer Hospital for Children Behavioral and Developmental Center. She assesses and provides psychopharmacological treatment for children and young adults. Her focus is on children with developmental delays, ADHD, autism, anxiety disorders, and learning difficulties. Musauer is a board-certified advanced practice registered nurse by the Florida Board of Nursing and also certified as a pediatric nurse practitioner and a pediatric mental health specialist by the Pediatric Nursing Certification Board. She earned her Associate of Science in Nursing degree from Valencia College and her Bachelor and Master of Science in Nursing degrees from the University of Central Florida. Joining us today by Zoom is Dr. Arthur Bregman and also nurse practitioner Rashonda Musauer. But joining me in the studio is Dr. Gilbert Franco. Welcome, doctor.
Thank you, thank you.
And our first question today is going to be for Dr. Bregman. Despite its lengthy name, attention deficit hyperactivity disorder does a poor job capturing the full dimensions of the condition. Can you provide a more fulsome summary of what ADHD is?
Do you have ADHD? Well, you know, it used to be called minimal brain disorder. And I've been practicing for 40 years. I've had people say, no, doc, I don't want that, okay? So you could understand that calling it ADD, people would say to me, doc, I got that. I think my friends have that too. So there's something about calling it something that is not a horrible name allows people to accept it more. So really, it's very important to address the issue of ADD if you have it. Usually it's good to go to see a clinician to see what's going on, get it addressed, come up with some kind of treatment plan, and get yourself on the road. You know, for adults, there's also adult ADD. Well, how do I know if I have ADHD? Well, there's a child forms and there's adult forms. You know, the children, they're really getting them in school. The teachers are getting much better at identifying them and sending them to clinicians. A lot of the kids could act as ODD, like oppositional defiant, learning disabilities, learning problems. The older kids tend to even develop substance abuse problems, be disruptive, be moody. So the thing to do here is don't put your head in the sand. Early intervention is what counts. See a clinician and get the child diagnosed in a good assessment.
Next question is for you, Dr. Franco. Why can parenting a child with ADHD be so frustrating, particularly when they have neurotypical children that they're also raising?
Well, that's a great question, and thank you for asking that. So, when you're looking at a parent, they have to, divide their attention into different siblings. And when a group of siblings have a certain needs, and then another group of siblings have their own needs, it can be very difficult for a parent to know what exactly to do because, again, parenting a neurotypical child is very different than parenting a child with ADHD, for example.
Okay. Well, thank you for that, Doctor.
You're welcome.
So our next question is for you, Rashonda. How does ADHD impact the rest of the family, particularly siblings?
So for many of our families, express concerns about interactions within the family with children with ADHD. And what we oftentimes find is parents are frustrated. Their siblings can be somewhat frustrated as well. But I also find that siblings tend to be quite forgiving, knowing that their sibling has difficulties with maybe some impulse control and maybe sharing and taking turns can be difficult for children with ADHD. But they also, do have some difficulties with those behaviors at times because it can impact the social relationship between the siblings. But for parents, most times I find that the frustration comes from just difficulty getting through your day-to-day tasks that should seem to kind of flow with routines and whatnot.
All right. Dr. Frankel, in your experience, is one of the issues that parents face when trying to parent a child with ADHD is their reluctance to accept that the child with ADHD has a different functioning brain?
Great question. Great question. So, in my experience, both teaching children with ADHD, but also being a therapist, I find that it's not so much that parents have trouble accepting. I mean, there is a group of parents that have trouble accepting. It's understanding what ADHD really is. And oftentimes through psychoeducation and through family therapy, one of the biggest things that parents realize is that, wow, my child has these differences, but at the same time, I could do something about these differences and help them out.
Thank you, Doctor. Our next question is to nurse practitioner Musauer. Generally speaking, what are some of the common problems children with ADHD face?
Some common challenges that children with ADHD face most times includes tasks and things that deals with focusing and maintaining attention. So with ADHD, it's broken down into a few different areas, but primarily the concerns are focus difficulties and poor concentration, which includes distractibility. And then we also have hyperactivity, impulse control. Those two oftentimes go together. And then we also have sometimes where there's emotional reactivity. So commonly what parents and teachers have shared with children with ADHD includes difficulties staying on task, following directions. We also hear just being very easily distracted, which prevents them from finishing tasks as well. And sometimes it's a misperception that the distractibility is from outside influences, when actually it can also be their own thoughts that may distract them as well. And then, of course, we hear the difficulties remaining seated, difficulties sitting for like dinner time and meals, and then impulsivity, kind of just thinking without or acting without thinking. If they see something really cool, they may dart out and go and check it out rather than ask for permission before going over to it. And then we also hear sometimes difficulties with sleeping. Sometimes there are also some sensory sensitivities involved with ADHD that are oftentimes missed as well.
Dr. Bregman, often in parenting, the focus is on modifying the child's behavior. In parenting a child with ADHD, my question is the reverse true, that mom and dad must modify their behavior first in order to help and to learn to manage the behavior of the child?
If your child has ADHD, what is the best approach for the family to deal with this? Now, family approach in treating ADHD is really important. What I do in my practice is I get the whole family together. And what I do is I say to the youngest kid, who here has it? And the little kid raises his hand. Dad. And I said, what do you think about that, Mom? Yeah, I think he's got it. So the family approach gets everybody on board and talks about what all the problems are and comes up with a treatment plan for everybody. So it's really important to have some family involvement, and that way everybody gets some help. Good luck.
Dr. Franco, what are some of the do's and don'ts that parents should put into practice when trying to raise their ADHD child to be successful?
Oh, great question. So I have 3 do's and 3 don'ts for parents to keep in mind. And that would be, let's start with the don'ts. So the don'ts would be, don't judge your kid, don't judge your child. Again, children have their own feelings and thoughts. And when you judge them, children are really good at picking them up. Another don't would be, don't assume that just because ADHD looks like this on the textbook, that it looks just like that on the child. And then number 3, don't assume that you or your child are always wrong in your behaviors. It could be that these behaviors are a manifestation of something else. Now, as far as do's, always, number 1, express empathy for your child and think, okay, how are things happening in your child's point of view? Number 2, to help you out with that, imagine yourself when you were a child and you're seeing this parent who is much taller than you, much larger than you, talking to you about what you're doing wrong. How would that feel like? And then number 3, always be there for your child when they need you. With an ADHD child, just like any child, they need their parents to be there with them. They need their parents there 24/7 to cater to their needs.
Well, thank you for that. And you make an important point, I think, that when you're parenting a child with ADHD, you're parenting one child with ADHD, that they're all going to be different and unique.
Exactly.
Dr. Bregman, few parents are going to be 100% supportive all the time. Should parents flog themselves for becoming overwhelmed or frustrated with their child? And a follow-up question, doctor, would be, how can mom and dad reduce the likelihood of such cracks forming in their parental armor?
Moms are coming to me all the time asking, Doc, I've reached the end of my rope. I don't know what I can do. It's really out of control now. I mean, what do I do, Doc? And look, I've seen a lot of these parents. They're all scared. They feel out of control. I help them understand that we could do something about this. Everybody needs to be involved. Let's get your child evaluated, possibly medicated. Let's make a good treatment plan, for the family and calm some things down. Look, this isn't a life sentence. A lot of kids with ADHD grow up to be.
Dr. Franco, ADHD reminds me of a jazz song by jazz great Fats Waller, Ain't Misbehaving. Now, a lot of times when a child with ADHD does something that we perceive as misbehaving, is it truly that, or is it something that they can't control most likely?
There are some times when a child with ADHD, just like any child, is misbehaving. But many behaviors that we think a child that has ADHD is doing that we find as misbehaving is not really misbehaving. For example, the hyperactivity, climbing the walls, running around the room. Again, children with ADHD can't help these behaviors, especially if they have that hyperactivity specification. So it really isn't their fault.
Well, how do you as a parent discern the difference?
Good question. So being a parent of 4 kids myself, it's a parent really has to get to know their child, and the difference in someone who is misbehaving and running up the walls versus someone who has ADHD and is running up the walls is that the one with ADHD does it with no triggers. In other words, they just do it with no other factors, whereas or purpose. Whereas someone who doesn't have ADHD, a child who doesn't have ADHD, does it for a purpose. For example, maybe to get a rise out of the parent, or to, maybe they are bored or something like that.
All right, thank you for that. Dr. Bregman, as for discipline, what works best for ADHD kids? Is using rewards and consequences, for instance, the best tact?
My child has ADHD. What should I do? Do you think some behavior modification is a good way to go? Absolutely. We're really good at behavior mod. You need a very competent therapist to come up with a good plan. It helps everybody. Everybody's on the same page. The kids know what they need to do, and the kids move ahead really quickly. So my advice is certainly go and get a competent behavioral therapist who could help manage your ADHD and use a comprehensive plan. Also think med management, some family therapy, etc. Good luck.
And another question to you, nurse practitioner Musauer. Because you deal in pharmacology, and we typically don't discuss medications on this show, but I'm wondering, how can parents make the best decision about whether or not to pursue prescriptions for their ADHD child?
The question regarding pharmacological management and medication for ADHD comes up quite often. Many times parents have unfortunately have heard negative stories related to treating ADHD with medication. So I usually urge parents, you really need to have a very open discussion with your provider, whether it be your pediatrician or a specialist like myself, but learning about the benefits of treating with medication, as well as the side effects or common concerns with treating with medication. I will tell you that majority of the time medication tends to be the best response that we have, in addition to school accommodations as well as behavioral counseling services. But I also teach parents that it's not a one method of treatment that's going to outdo everything. So you really need to kind of have an around approach that treats from different angles, so that we can treat not just during the day, but what do we do when medication wears off? Or, what do we do when we're not responding to medication? So those are things you really should discuss thoroughly with your provider, so that you can discuss myths and, dispel some myths and maybe learn some truths about really what we recommend and why we recommend them.
Well, I'd like to thank Dr. Gilbert Franco, Dr. Arthur Bregman, and nurse practitioner Rashonda Musauer for joining us and sharing their wisdom today. Do you have questions about learning differences? Are there concerns you're facing daily in your journey with learning and attention issues? We're happy to answer your questions on air. Sign up via our website, awodtv.org, to have your questions answered during our Ask the Expert segment on an upcoming episode of A World of Difference.